before I enter my patient's room, I check the outside for any precautions, any flags, or anything I should be aware of. I see none, so I'll go ahead and enter. Hi, my name is Sarah. I'll be your nurse today. I'm here to do a head-to-toe assessment. Is it a good time?
Yes.
Okay, and I go by she, her. How would you like me to address you?
Just Rohi, she, her.
Okay, and your vital signs, I see that your vital signs were already obtained and everything looks in range. Just give you some privacy here. Okay, do you experience any pain? Can you rate your pain on a scale of 0 to 10?
0.
Please? 0, okay. So before I do the assessment, I am going to ask you a couple of questions. First of all, can you tell me what brings you in?
Just consultation.
Okay, and can you tell me where you are right now?
W Hospital.
Okay, and can you tell me the month and year we're in?
July 2025.
Perfect. Have you had any hospitalizations or surgeries? Okay. Alright, so any symptom of cold, flu,
No.
are you coughing?
No.
And when you do, what's the sputum color like?
Square.
Okay, any chest pain, shortness of breath, headache, nausea, vomiting?
No.
Numbness, tingling, dizziness?
No.
Okay. Are you sleeping okay?
Yeah.
Okay. Do you smoke? Take alcohol or any recreational intoxicants? No. Do you experience any symptoms of anxiety or depression?
No.
Okay. And do you have any cultural or spiritual considerations you want me to be aware of?
No.
Nope. And so as I do the assessment, I can have more questions for you, but one last. Do you have any allergies?
No.
Perfect. Alright, I'm just gonna go ahead and get started with the assessment. If you feel any pain or discomfort on any part of this assessment, just do let me know, okay?
Okay.
Alrighty. So I'm gonna give the privacy a bit more. Alright, so I will start by just elevating the bed so both of us are more comfortable. Is that good?
Yeah.
Okay, so I will start by inspecting your neck. Okay, so I see that trachea is midline. I'm gonna be palpating and turning. Okay, so can you go ahead and turn on your left? And I see no jugular vein extension. I'm gonna just take a feel. Perfect. And can you do the same on the other side? Oh, perfect. And I see that you have no portals. I see no oxygen plug. Do you use any oxygen at home?
No.
No. Okay. And I see no IV or PICC lines anywhere. I see no Foley catheter present. And your skin looks dry, warm, intact. I see no bruises, no discolorations. Everything looks good in there. Okay, so next we are going to be looking at your cranial nerves. I'll start with cranial nerve 1, that is your olfactory. I will put something under your nose and I will ask you to identify what the smell is with your eyes closed, okay? Go ahead and close your eyes.
Alcohol.
Perfect. Next, I'm going to be assessing your vision senses. They are your cranial nerves 2, 3, 4, and 6. They are your optic, oculomotor, trochlear, and obtusans. So I'm going to be holding up some fingers here and you tell me what number you see.
5, 3, 2.
Perfect. And I might just shine some bright light on your eyes and see how your pupils react, okay?
Mm-hmm.
Alright, just look straight ahead. Perfect. And pupils dilated evenly, they're reactive, so very good. Can you watch the tip of my pen?
Yeah.
And do not move your head, please. Perfect. And how'd that feel?
Good.
Everything's good. Okay. So next cranial nerve I'm going to be assessing is your trigeminal and facial. They're 5-7. Can you smile for me? Frown, puff cheeks, and wrinkle forehead. Okay. And all right. And I will touch random parts of your body. And can you close your eyes and tell me where you feel? Okay.
right cheek, chin, left hand, right hand, right upper hand, thigh, left thigh, right lower leg, right foot.
Okay, so all sensations are intact. You can open your eyes. And next cranial nerves I'm going to be assessing are cranial nerves 7, 8, 7, 9, 10, 12. They are your facial, glossopharyngeal, your vagus, and hypoglossal. Can you stick out your tongue for me? And swipe right to left. Okay, perfect. And can you say Alright, so the uvula rising, no bruises, no ulcerations. Okay, can you go ahead and dry swallow for me? Perfect. Alright. Next, I am going to be checking your cranial nerve 8, that is for your hearing, that is vestibular cochlear. So can you close your eyes and tell me with which ear you hear my fingers making a noise?
Left, right.
Perfect. You can open your eyes. And the next one is your cranial nerve 12. That is your spinal accessory. So can you shrug your shoulders for me and turn your head? Okay, right. And the other way around. Perfect. Okay. So all cranial nerves are grossly intact. That is awesome. Next, I'm going to be just assessing your upper extremities, your arms.
Okay.
So I will just take a feel, and I see no edema, no crepitus. I see that your skin is warm, dry, intact. So no bruises. I see no dressings. Bony prominences are good. So while I'm here, I'm gonna be checking your capillary refill. So on these 2 fingers. Alright. Perfect. And the same one here. And here. Alrighty. Can you grab my 2 fingers and squeeze them as hard as you can? Perfect. Can you do this for me? And just push up and down. And while I'm here, I'm also going to be checking your radial pulses, okay? Alright. Okay, nice, strong, bilateral, even pulses. Perfect. And I'm going to go up your bronchial. So, there. Nice and strong. Perfect. Okay, next I'm going to be listening to your chest and your lung sounds, okay, on both front and back. While you're breathing in and out, I see that your chest is expanding evenly, symmetrically. You have no history of asthma or any respiratory problems?
No.
Okay, perfect. Alright, I will be palpating first and then taking a listen, okay? So, starting with your right, on your right, your atrium, that is on your second intercostal space, right sternum border, okay? So I'll be right over here. I'm going over your pulmonic, that is on your left second intercostal space, on your left sternum border. Nice and strong. Is that okay if I expose you?
Mm-hmm.
Okay. I'll move down to your tricuspid. That is on your left sternum border on the 4th or 5th intercostal space. Then I can just go up here and see. Alright, and I'll move down to your mitral wall, and that is going to be on the mid-clavicular line on 5th intercostal space. So it's gonna be over here. Alright. Perfect. I see that your skin is warm, dry, intact. Everything is good. I'm good. I'm just gonna take a listen. Alright, starting over here again. Listen. Down here. Okay. There. The other way around. Perfect. And I'm just gonna do the same with the bell of my stethoscope to see if there's any murmurs. Okay. Just gonna leave it here. And here. here. I'm gonna go over here. Okay, everything looks good. Alright, and now I'm going to be listening to your lung sounds. So I already palpated and felt no crepitus, swelling, no dressings, bruises, nothing. So I'm just gonna go ahead and take a listen, okay? Alright. So you can go at your own pace. I'm just gonna raise the head of the bed a bit so you can do this better. Is that comfortable?
Yeah.
Yes. Okay. Alright, just go at your own pace. I no need to rush. Alright, let's go ahead. Just go down a bit. There. I'm just gonna go on your right, just be here. Okay, perfect. And can we do the same on the back? Okay, so before I get going, can you take a deep breath for me? Alright. Good, equal symmetrical chest, back expansion. Alright, so I'm just gonna first palpate and see. Your skin is warm, dry, intact, no discolorations, no bruises, no swelling. So I'll go ahead and take a listen. Okay. Okay. I already listened the my area, but let's do it one more time. That's perfect. Okay, you can go ahead and rest. Alright, so while I'm here, I'm also going to be listening to your belly and see how your movements are doing. And before I do that, I have some questions I want to ask you. Do you feel any abdominal pain? Any problems with your urination while voiding? Do you feel any pain, painful urination? No?
No.
And how is the odor and color?
No odor and clear.
Perfect. Any history of kidney stones, any GIs?
No.
Perfect. And history of constipation, diarrhea? No. Okay. Any changes in urgency or frequency? Okay. Any urinary retention?
No.
No. Perfect. So I'll go ahead and take a listen first. I'll start with your right lower quadrant. Going to use over here. Okay, I will go up. That is your right upper quadrant. I'll move to your left upper quadrant and the left lower quadrant. Okay, alright. No hyperactive or hypoactive bowel sounds. They're all active in all four quadrants. Everything looks okay. I will take a feel, okay? Is that a comfortable position?
Yeah.
Maybe I can lower the bed a bit so you're more comfortable. That's good. Okay. Alright. I'm just gonna taking a feel. Let me know if you have any pain.
No pain. No pain.
Okay.
No pain.
No pain. Perfect. And I will also be checking for tenderness, rebound pulses. So I will just press firmly and you tell me if you feel any pain as I press down or as I release, okay?
Okay.
Alright.
No
How'd
pain.
that feel?
No
Perfect. Okay, and I see that you have no Foley catheter and you answered all questions with indicating that you have no problem with your urination. So I will not check the perineum area, but if you did, I would do that. But I will be checking for any urinary retention, okay?
Okay.
So I'll just go a bit more deep down and press gently, okay? Alright. Okay, how'd that feel?
Okay.
I felt no nerve retention, everything good. Everything's good. So I will cover you back up. Alright, I will move down to your lower extremities. Okay. I'll be exposing you a bit. Okay. So let's first start with taking a feel. I see no edema. I'm not hearing any crepitus. Everything looks okay. Skin warm, dry, intact. I see no swellings, no dressings anywhere. I'm gonna check your heels, and I see no bony on bony prominences. I see no pressure injuries. Everything looks good. I'm going to be checking your strength. So can you just press down and up? That is awesome. I will be checking your pedal pulse. So right here. Nice and straight and bilateral. I will be checking your posterior tibial. Over here. Okay, that is awesome. I will be checking your capillary field too. So just here. And the other finger right here. Oops, over here. Okay. All under 2 seconds. So, alright, and let's do the same for your hands. Okay, let's be checking. You already checked, right?
Yeah.
Okay, let's just do double. Okay, everything looks good in here. Next, I'm going to be checking your gait and balance. Okay, so I will move down. I will lower the bed. No dizziness.
No.
All right. I will have you sit up, and your legs over here. Okay. So I will have you stand up with your feet closed and close your eyes. I'll be right here. Okay, perfect. Now can you walk towards me, heel to toe? Right. Alright, and as you walk backwards, just walk normally as you would. And just stand right there for a minute. I'm going to be inspecting my patient's back, buttocks, and lower legs. And everything looks okay. I see no any kind of injuries, no discolorations, no swellings. Everything looks good and warm, dry, intact. So you can go ahead and get back in bed. Alright, and as I talk to my patient, I see that my patient is alert, oriented, follows commands. I see the mucous membrane moist, speech is good, oriented. Can you now rate your pain on a scale of 0 to 10?
0.
Okay, perfect. So do you have any questions for me?
No.
Okay, all your positions are in place? Do you need to use the bathroom?
No.
I will give you your call light. It's going to be right here. I'll open up the curtains so you get more light in your room. And well, thank you. That is the end of the assessment. Okay. So to document my findings, before I entered the room, I checked for any precautions. I have seen none, so I just go ahead and entered. My patient was alert and oriented to time, place, and the person and situation. Speech was clear, appropriate. Was able to follow commands. Trachea was midline. Mucous membranes moist. No crepitus. No dressings on any part of the body. Skin warm, dry, intact. Chest movements and back expansion were symmetrical and just even. Chest heart pulses were all bilateral, equal, strong. Good chest expansion. Lung sounds were clear, no crackles. Moving down, all 4 quadrants were active, no hyperactive or hypoactive bowel sounds, no urinary retention. Strength was good in upper and lower extremities. Cranial nerves from 1 to 12 were grossly intact. My patient's gait and balance and coordination were good. Capillary refills on both hands and toes were under 2 seconds. no S1, S2 heard without splitting. In chest sounds, pupils dilated evenly, were reactive to light, and they were round. Patient reported no pain, and that is the end of the head-to-toe assessment.